This is Mayo Clinic Talks, a curated weekly podcast for physicians and healthcare providers. I'm your host, Daryl Chetka, a general internist at the Mayo Clinic in Rochester, Minnesota. Musculoskeletal pain is extremely common, especially as our patients become older. Those of us who have a primary care practice commonly see patients with tendinous injury or inflammation, meniscal tears, and osteoarthritis. Unfortunately, our treatment options have been limited and may include watchful waiting, hoping for improvement, anti-inflammatory medications, steroid injections, or physical therapy. When severe, some patients benefit from joint replacements. However, until our patient reaches the time to consider joint replacement, our efforts to help our patients often leave much to be desired. A relatively new treatment approach has appeared in the past decade: musculoskeletal regenerative medicine. But does the research back up the numerous claims of benefit? We're going to get the true current and future potential of regenerative medicine for musculoskeletal problems from Dr. Shapiro, a sports medicine physician in the Department of Orthopedics at the Mayo Clinic. Shane, welcome.
Thank you. Thank you for having me.
Well, let's talk about this interesting problem. In musculoskeletal medicine, what challenges do you see for the current standard of care medical approaches that may not completely address our patients' care?
Well, you certainly highlighted part of that in your introduction there very nicely. Most of what we're treating on a regular basis are chronic degenerative conditions. A great example of the challenge in treating those chronic degenerative conditions, like take osteoarthritis, for example, is that our initial management of knee arthritis symptoms utilizes that conservative of care that you mentioned. And those treatments are actually quite good, but the long-term efficacy of those treatments is somewhat poor. And so things like NSAIDs, physical therapy, steroid injections, they can become ineffective over time. And then in late stage arthritis, as you mentioned, arthroplasty may be considered for patients with severe pain and disability. And these surgeries also have excellent outcomes. However, a treatment gap exists for those patients that do have symptomatic knee arthritis that are unresponsive to conservative care, but not yet ready to undergo or not an appropriate candidate for more invasive surgical procedures like arthroplasty. And as a result, millions of patients may linger in what we're calling the arthritis treatment gap, which that treatment gap can extend 20 years through the majority of the younger osteoarthritis patients' adult life. So if you do develop symptoms in your early 40s, you could spend decades with those symptoms until you're a more appropriate candidate for arthroplasty. And this protracted period will include debilitating pain, reduced quality of life, and significant financial burden sometimes too. So as a result, there's a great need for safe, effective, and cost-effective treatment options for patients with moderate to severe osteoarthritis, and something that will enjoy high patient acceptance. That's what we're on the hunt for.